5 things you should know about inducing labor with a membrane sweep from a high-risk labor and delivery nurse. Number 1, you should know what a membrane sweep even is. Your bag of water or your amniotic sac is actually connected to your uterus during pregnancy. And when a provider does a membrane sweep or strips the membranes, the provider would then do a vaginal exam with a gloved hand going through the vagina, through the cervix, and separating the amniotic sac or your bag of water from the lower uterine segment. The idea is that this would prompt your body to release hormones, prostaglandins, and soften and thin out your cervix. Maybe even by stretching and moving the cervix around a little bit during the exam, your body might release a hormone called oxytocin, which stimulates contractions. Number 2, some potential benefits of having your membrane swept. Oftentimes, this does not have to be done in the hospital setting. It can be done in a clinic or outside of the clinic if your provider sees you at home. Another possible advantage is this is a way to try to induce labor without the use of medication or cervical ripening balloons or other mechanical dilators if that's something you're trying to steer away from. Other pros, a membrane sweep can be used on its own to try to induce labor, or it can be used in combination with other methods of induction. Number 3, risks and considerations. It can be painful. I've had a few of them. They're a little uncomfy. It can cause spotting or some bleeding afterward. There's also a risk of your bag of water, your amniotic sac, being broken during this procedure. There's also the possibility that the membrane sweep does stimulate painful, uncomfortable contractions, but we don't actually go into labor and just having some discomfort, you're losing rest. Which brings us to another con to keep in mind is that sweeping the membranes can be helpful for some people, but in a lot of cases, it doesn't necessarily lead to labor. Number 4, sweeping your membranes is a method of induction and requires consent before it's done on you. This is a method of induction that does have risks, benefits, considerations, and it starts off very similarly to a cervical exam. It's very important that you and your provider have a conversation that discusses everything that you'd like to know about this procedure before it's done. I just want to stress the importance of making sure we all have consent before we do any procedures, any interventions, any medications. Number 5, you also have the right to ask for your membranes to be swept. You have a right to talk to your provider about all forms of induction or intervention or plans of care. If you are thinking about moving forward with an induction, or maybe would like the idea of having your baby a little sooner without a formal induction, this is a great thing to just talk to your provider about, because it's absolutely within your right to explore different methods of induction like sweeping your membranes. As always, this varies from person to person, so it's going to be a collaborative effort with you and your provider. For more information on pregnancy, birth, postpartum, babies, give me a follow, check out my page.